can't touch my hat, my mask, once I'm scrubbed. So I want to make sure I get everything the way. Oh, what am I missing?
Your badge?
Missing my
Oh, no.
eye protection. Did I show you guys the mask that has the shield
Yeah.
last week? So that's what I prefer. I just don't have any of those. Have a few of those, but not for us to practice with all the time. So when you're practicing, use these safety goggles, okay? They are more expensive. The masks with the shields. You will have your own radiation badge, film badge, that we talked about on Tuesday. So this is what I didn't talk about. I talked about wearing it on the outside of the lead. My suggestion is that you wear it on your collar on the left side. Just get in the habit, okay? Now you could wear it on your pocket. It's pretty close to your face, all right? Some people do like to wear it on their pocket. I like to wear it on my thyroid shield as close to my face as possible so I can get what the true reading that my eyes and face are getting, okay? And then I like it on my left side because look at this. If I'm scrubbed in next to the physician, which side of me is closest to the radiation source? The left side. So I always want to know what is the maximum amount of radiation exposure that I could have gotten. Okay, so even when I'm circulating and I'm back here and I may be turned this way or I may be turned this way or I may turn this way to get something out of the drawer for a few minutes, but most of the time I am turned this way to watch the monitors, to see what's going on, see what they might need for me to do. But because when I am scrubbed in, I just think if you get in the habit of doing it this way all the time, then when you are scrubbed in, you'll already have it in that position and you'll be ready to get that whatever the most exposure might be, okay? So the next step is scrubbing in. Now, come closer. So, like I talked to you about the videos that I showed you the one that's the surgical scrub. That is a true surgical scrub. And if we are going to scrub in for TAVRs or implants, say a pacemaker, that is the kind of scrub we really should be doing. For cath lab scrubbing in, a lot of people have actually even gotten away from totally scrubbing in. They use the hand cleaner, okay? So I had another video that I didn't post because there were some things I didn't like about it, and I didn't want to post too many and overwhelm you guys. But there is another video that I found that shows at the end about using the hand cleaner, and I may go back and post it because I don't have the hand cleaner here to demonstrate, but it is something, even some doctors aren't doing the scrub. My suggestion, and they did suggest this on, I think it was on the cath scrub in, about the very first, and you're getting closer and closer to that, so just be cognizant, be thinking, that is open and that is sterile now. So don't, even when you're in the lab, if you're watching them trying to show you something, whatever it be, make sure you're aware of all that's around you, okay? So I'm going to show you a 2-minute scrub for the cath lab, which is usually, it's pretty sufficient for all labs, right? And like I was saying, some of your presets are going to say, oh, we don't scrub our hands here, just use the hand cleaner and go on. Best practice is that we do it, but most of those places, they don't have a high infection rate. And so if that's their policy, then, that's okay. But you do still need to know how to do the scrub because some places they are going to want you to. And I'm just going to tell you, it's a good practice. Even if they don't scrub every case, when you first get in the morning, to do a scrub. Just so you've cleaned under your fingernails, you've cleaned your hands well for the day, and then if you want, you scrub in multiple cases, then you could use that hand cleaner, okay? You're gonna open up your package. Now, they talked about doing a hand wash before. Yeah, we don't normally do that. Again, that's for that surgical type scrub. So we're just gonna go forward with using our sponge, okay? So you wanna take out first and you can just set that there. One of the things here, this is not like a scrub sink is really gonna be. There's not gonna be something hanging, or there shouldn't be anything hanging down, but even that one video where she kept telling her, be careful, don't hit the nozzle, don't hit the nozzle. So if you do hit anything, hit that when you're up here scrubbing. And so before I start, I try to get that out of the way so it's not hanging down. You gotta restart, okay? Now, the sinks are gonna be different, and so this is a foot pedal sink. You have to actually hold it down while you're doing. Some of them are sensors, and so while your hands are underneath, the water will run, okay? That being said, first thing we wanna do is wet our hands, and we're gonna take the little cleaner, and the big thing is cleaning under the running water. And I will tell you the truth, I usually only do this on my first scrub. Even if I do scrub every case, I only do this the first thing in the morning. As long as I haven't got something visible underneath my fingernail. But you are going to need to do this for practical purposes because I want to make sure you can do it. Okay? I do have a little garbage can right here. Okay. So then I'm going to and if you can, get that in the garbage, get in the garbage. If you can't, it's okay. You want to get your sponge and get it good and sudsy. Now, I did notice on the calf, I believe she scrubbed her hands with this harder brush. But on the surgical, they talked about don't scrub your skin with the hard brush. And so the way that I do it and the way that I'm going to teach you to do it is you're going to scrub your tips of your fingers with the hard brush, but then everything else we're going to scrub with the soft side, okay? So what we're gonna use is the counted method 20 times to the best of our ability, okay? Because we're trying to do about a 2-minute scrub, not much longer, all right? And you're gonna be timed on all of this. I'm gonna give you more time on the midterm and then shave off some time for the practical. And then once you get in advanced, we're gonna shave off some even more time. So we should be able to do everything that I've just done within that's opening the tray, passing off, not really passing off the items, but opening the tray, opening this, getting dressed, scrubbing, getting gowned and gloved. I think I gave them 7 minutes. That was advanced. So at the final. So it is doable. Almost every one of them did it. Anyway, big thing is keeping our hands up. Trying to get our thumb. 10. And I just count to 20. It's probably more than 20 strokes because I go a little fast. And remember they said 1 stroke is counted as that way and then back. And instead of doing 1, 2, 3, 4, 5, that's just stupid. I just do 1, 2, 3, 4, 5, and I'm probably doing more, but I count to like 20, okay? All right, I'm gonna make a set way because there are different ways. Some people will do the fingertips and then do the hands and then do the arms. We're gonna do hand, hand, arm, arm. That'll be the best way, okay? And that's fine. It is that's how they did it, I think, on the surgical scrub. All right, so then we're gonna switch the planes of our hand. I talked about the 4 planes of your hand. Your palm, both sides, and the back of your hand. So those are the 4 planes that we've got to do. Now they scrubbed in between the fingers. We're not going to take the time to do that. I'm going to demonstrate how we're going to get in between our fingers with our palms and the back of our hand. So I'm going to start with the side. Go to the palm, and what I do is I kind of open my fingers and kind of force that sponge in between my fingers, And then that way I'm getting in between my fingers without having to do 1, 2, 3, 4. That's just a little more than we really have to do in the cath lab. Now, if we're doing a surgical scrub, they may want you to do that 5-minute scrub. With that 5-minute scrub, then you are gonna do all the fingers like they did on that video, okay? But we're just gonna do our plane. Keep your hand open, go to the side. Back, and do the same thing. Okay, now I'm gonna go ahead. If I need to get more suds, I can. I'm gonna go to the other hand. You see how I'm keeping my hands up too? I don't go down. Now, if I've got a wet, I do have to kind of go in, but okay. And it doesn't matter which order you go in on the planes of your hand, as long as you remember to do all 4 planes of your hand. Okay, now I'm gonna do my arms. 2 planes of your arms is what we're gonna do. They did 4 sections. We're gonna do just the 2 planes, so from wrist to elbow, okay? So, 1. This is where you could hit if you're not careful. It's okay if you step out. That's why we have a rug. You see how I'm kind of going to the sides? So I'm getting all the way to the sides. I'm going to do the same on the back. Okay? Some of my suds are going away, so I'm going to be sudsy again. And I'm going to go to my other arm. Then if I have a garbage, I'm just gonna drop it in my garbage. If not, drop it in the sink. This is very important. This is where we don't put our hands down, right? So we don't want anything dirty from elbows running back onto clean fingers. So for a taller person, I've gotta kind of go down in, but you just wanna make sure that you go in kind of slow. You can, you know, they did this like kind of shaking motion. And so you have to bend your body. See how I went through and then I brought my hand up. On the cath video, she did it several times. As long as you get all the soap, you can do it just one time. But if you still see visible soap, then you could go back through. So if I thought, oh, okay, I need to go back through. Keep your hands up like this.
Open the lid.
That's okay. I'm gonna dry it. All right, then I'm gonna come over to wherever I'm getting my gown, my towel. The towels are usually white. We reuse these because they're disposable towels. I'm gonna try to get in and out as quick as possible so I don't put anything wet. So I'm just gonna try to figure out, okay, I'm gonna grab my towel. And I'm gonna start drying. And it doesn't matter what hand you start drying first, whatever you're most comfortable with. The thing that matters is that you don't let the bottom of this towel hit you. So you may have to kind of bend out a little bit. And you also don't want to go down and then come back up. So you can't do like this. You go around. Okay? Now, clean, dry hand. I'm going to touch clean, dry towel. Flip it. Dry the other hand the same way. Now it doesn't matter if this did kind of hit me because that's dirty anyway. Normally, we would throw these in the garbage. They're disposable. We saved these, so I'm just gonna toss it right there. Did you notice? Whatever hand I ended holding that towel with, that's the hand I discard it with. I don't grab it back with this other hand. That's very important, okay? We're almost out of time, but it is lunchtime. You don't have to be anywhere with, you have to be somewhere, but, so I'm just gonna proceed to show you how now we're gonna gown and glove, close glove very quickly, okay? So you're gonna grab the gown. The gown is inside out at this point. Usually there is some indicator of what side is the neck, okay? The armholes are gonna be here. This, that's solid, so see how that's open? That's solid. The solid is what's gonna go towards you. If you open it up this way, you're gonna end up, that's gonna be the outside, which has to be sterile, that's facing you. This is the inside, which is gonna be touching you anyway, okay? So you wanna look for that neck area. You step away, okay? So that you don't hit anything whenever your gown opens. I hold on, and then I kind of just let it fall open. I'm gonna start working my hands in, okay? All right, Layla, come here. And so you're gonna close me, and they showed this, hopefully you guys watched. I like to do the top first, so do the Velcro first. You're gonna reach inside. There should be a tie inside.
Right here?
Yep. And then a tie on the outside. If it's not broken.
I see a hole
That was where the tie was supposed to be. So you would just tie that in a bow or a knot or whatever, okay? And that's it for now.
Oh, okay.
Yep. We can't do anything with this until I get my gloves on, okay? And that would be your job as a circulator. You're gonna be tying up the scrub tack, you're gonna be tying up the doctor also, okay? Now with closed glove, you have to keep your hands inside. I feel like a T-Rex, and because this is a smaller gown, just do it as barely as you can. And I'll try not to pop it. But this is a smaller gown, and I feel like T-Rex. Okay, so we have to keep everything sterile. And so we're gonna come and open. And you see how I do have to also try not to rub all up against. So I'm kind of bending my body because I want to keep anything from my waist to my chest. That's what I need to stay sterile on me. Okay? I'm gonna open up. And this is important because, say, if everything was on my sterile tray and I'm doing this on my sterile tray, same thing, I don't want to contaminate my sterile tray. Okay? Now, the suggestion is to glove your dominant hand first. So if you're right-handed, glove your right hand first. If you're left-handed, glove your left hand first. There's no true rule about that. Whatever's most comfortable for you, but that's a suggestion. Mallory, can you push my glasses
I was
up?
gonna do that now.
Thank you.
They're falling off.
Yeah.
Didn't want to
And see,
interrupt you.
I couldn't reach up and touch that. So that's the same thing that could happen in the lab. They may ask the circulator, the non-scrubbed person, to help them because I can't touch it, okay? So for closed gloving, the technique is you're gonna pick your glove up, and I'm gloving my right hand first. I still see my fingers are inside. And I'm actually going to flip my glove, and they talked about this on the video. Thumbs, so this is the thumb, these are the fingers, and I'm gonna flip it so that my thumb side is down and the fingers are pointing towards me, okay? Then I'm going to, and these are sticky gloves, so they can be difficult at times. I'm gonna grab my cuffs. And what I'm gonna do is hold on, and then I'm gonna flip and pull down. And now I have one sterile glove on. Now I don't like, that's a little too high for me, and it's not, but I'm gonna adjust it and I'm fogging up. So pull them down just a little bit. That's okay, I think so. Okay, I'm gonna take my second glove and I'm gonna do the same thing. so when I pick it up, it's palm facing up. They're always packaged the same. Okay, the right on the right, the left on the left. Palm up. I'm gonna pick it up and I'm just gonna flip it. Fingers pointing towards me, palm down. I'm gonna do the same thing. Open it up. Grab a hold of my cuff. And flip. Pull it down, and now I can do some adjusting. Now, you do have to be careful. This one's already got a rip in it. I just noticed. I'm gonna toss it because it already does have a hole in it. But gently, I have pulled and ripped a hole right in these things before. But that cuff up there around my hand, it bothers me. Now, it may not bother you, it may be fine, but the big issue is like this. You can't have that white exposed, because if water or fluid hits that white, that's not water repellent. This is water and fluid repellent, okay? But the white is not. So you want to make sure that your glove comes down and covers that white. So I'm gonna, that's a little bit high. I don't really like it. I'm just gonna kind of adjust. I can always pull out. I just can't really put it back in. Okay? So now I just closed glove. Now the next thing I'm gonna do is get some help closing my gown. Okay? So you want to keep the right hand a hold of the cardboard. Okay? And you want to keep the string in the cardboard. So you're gonna pull, hold on to the short string in your left hand. All right, Layla, come and help me. She's gonna grab just the blue part, and either I'm gonna twirl or she's gonna walk around me. We'll just have you walk around me. Be gentle, because when she puts them back in, she doesn't get them back in quite. They're a little in there better whenever they come out of the brand new gown, but these we have to just be a little gentle. So then come around just a little bit more. And I will grab just the string. You take the cardboard, and then I can tie. Okay? And now I'm scrubbed in. This is where I want my hands to be. No, 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 no. We do not walk over to our tray like this. Okay? The things that are sterile on us, as I've already mentioned, waist to chest. Okay? So not even neck area. It's too close to touching my skin and touching everything that's not sterile. The front of my arms from chest level is considered sterile, but not the back. Nothing on my back. From elbow down, all of this is sterile. And they actually do ask that on registry. They'll possibly give you a picture, ask you questions about where are you sterile. So also, I don't really want to walk with my hands like this, because say you're in a hurry, you come close to me, you could hit me. In the lab, I told you, you're always in somebody's way. So if this was where I just got scrubbed and now I need to walk over to my tray, you guys give me enough room. And now I'm going to walk over here to my tray, and I can start setting things up. Okay? All right, so that gives us a good bit to start practicing.